Hi, my name is Diana Geisler, and I am going to be talking today about intellectual disability and the environmental and cultural factors involved with this. Just a quick recap. So, what is an intellectual disability? So, when there are limits to an individual's ability to learn at a specific level and function in daily life, this is what categorizes as an intellectual disability. And there are many different levels of this disability, and they may be able to function independently or not at all. And just like in this picture here, you see so many different things. It's a disability like this isn't just one size fits all. Someone has also explained it as being as though you're looking through a kaleidoscope and there's all those different colors and shapes and sizes. So media has a impact on intellectual disability. I'm just going to touch on a couple of these, but there are distorted images of what this looks like. Sometimes they're assumed to be dangerous or unpredictable. They may portray them as being dumb or slow. And these effects on people who struggle with this disability impairs their self-esteem. It might stop them from wanting to get help. Maybe they feel ashamed. And it may affect their adherence to medications that they might need. So peers play a role with people who struggle with intellectual disability or delay. Oftentimes their peers, especially, I guess really at any age, but they're misunderstood. People say because someone who is on the spectrum, there's so many different levels. People might assume that they are that they can't focus, that they're hyper. There's just a misunderstanding. It's important to educate our community on these disabilities. It can have a huge impact on their self-esteem and their overall outcome. It's also important, family being a peer as well, to some extent, to teach them about developmental milestones and that they matter. There's to learn the signs, to learn what's expected, what's normal behavior at certain ages so that you can catch these delays at an earlier age and get the help needed. So is this a cyclical nature? It can be. So there's several reasons why one ends up with intellectual disability. It could be injury, maybe at birth, maybe later in life, a brain injury. It could be in mom's womb, disease, stroke, infection. Infection could happen in utero. It could also happen at birth. It could happen later in life. Some of the most common intellectually delayed that we hear about is Down syndrome, Fragile X, fetal alcohol syndrome, and autism or spectrum. And some of these are hereditary. So then, yes, it would be cyclical. Many of these are actually unknown as to if they are genetic or not. So within the legal political system, there are some really good organizations to help those with disabilities and specifically those struggling with intellectual delay. This one is Administration on Disabilities, AOD. They do some amazing things. They collaborate with states, communities, partners in the disability network, and in this network, they are creating opportunities and helping individuals and families access tools and different support so that they can live in their communities, whether independently or with a family member or somewhere that's safe for them. They also are able to increase life expectancy by addressing some of these health disparities through organizations like this. I think education is a huge part of this. Here are some different areas where they target specific needs for these individuals. This one hits close to home for me. So, potential barrier. Family. So, a barrier could be that the family is uneducated. They don't know, especially in some of these ones, like this is my daughter, Chloe, and I knew something was off, but I didn't quite catch it early enough. There's a lot of other life stressors happening at the time. So she does a really good job at acting like everything is fine and okay, but really it wasn't. So I probably could have been better educated. She appeared to be normal. She is normal, but some things aren't. Sometimes the schools, maybe the teachers are overstressed and they overlook unless the signs are obvious. And thankfully, we were able to get lucky and identify that she does have learning disability and she does have an IEP so that she's able to have instructions and tests read to her because her comprehension isn't what peers at her age should be, and she has a low IQ. So this is a barrier, is that she appears to be okay, and really she needed help. And some of these other barriers are if someone doesn't have, in a low socioeconomic status, if you don't have the money or the means, you can't get help. And it can be expensive to get medication and therapy and to have a psychologist analyze you and test you. So socioeconomic status as a health disparity, there's higher medical expenses. They can have increased prevalence of diabetes, heart disease, and stroke, undiagnosed poor vision, difficulty accessing healthcare is needed, as I talked about earlier, and as a result, they could have secondary disabilities. So there were some health disparities in regards to race and ethnicity. Some of the research that I found showed that Blacks, Latinos, and American Indians, when compared against the Caucasian environment, they were higher. There were more of these individuals that had the intellectual delay. So religion, I didn't find very many negative things about religion and disparity. Actually, quite the opposite. There was research that showed that religion can be hopeful with a diagnosis like this. It can bring hope for the family and the individual. It can also help them have better coping strategies as they move forward with their new diagnosis and to have some better resiliency. Gender. Males are more likely to be diagnosed. There were also some interesting articles on research in gender identity or gender dysphoria, also autism spectrum disorder and gender dysphoria as well. There was some research that showed a connection with gender dysphoria and intellectual disability. Geographical location and health disparities. So here, if you have patients who are in individuals who are in a rural population, they can have reduced access to services that are needed. They might have a more difficult time receiving medication refills that they would need. And this could be because oftentimes with some of these medications, you need to have frequent assessments and visits with the doctor. And this is why telehealth would be a really good option for these individuals, but that takes education to know that that's available. They would need to have assessments done and evaluations as needed, assessments and evaluations as needed, and that could be accessed via telehealth. So bias, you have your implicit and explicit bias toward these individuals. There's a term called aversive disableism attitude, and this is just kind of like an attitude where they don't really know they have it, but they do. And I really like this quote that I found. This woman says, "Whenever I go into the doctor's office, they talk to the people that bring me, but it's my life and it's my illness. Can you respect me enough to talk to me?" So maybe the person who's bringing them has some of this, a stereotype, or they don't know they have it, but they actually do. And it's important to let those individuals who can talk for themselves. And then there's a more obvious bias, which is explicit. And sometimes social distance plays a big part here, where they just don't, maybe people don't know how to interact or handle somebody with a developmental delay. And the last thing is international scope. And this was really interesting. There's actually 200, in 2021, there's 200 million people who have, and this 200 million people is 2.6 of the world's population. That is a pretty large amount, and I really enjoyed learning about this and have a passion for it, and specifically have a passion to help those who might not be as obvious, that we can help them. And I think that we can help narrow these health disparities as we are better educated and we can serve our communities better, looking for the signs and helping those who don't know how to ask for help.